Joining me today is Dr. Lucas MacMillan, naturopathic physician and medical director of the Delbrook Integrative Medical Centre. Dr. Lucas MacMillan is here to talk about body composition over body weight. And what an interesting topic we're going to be talking about today, Dr. Lucas MacMillan.
Absolutely, yeah. I'm excited to dive in. This is something that my patients ask me about and that I think in a big way is undervalued and misunderstood. So I'm hoping to clear some of that up.
When you think of body weight, I mean, you may look great outside, you look fit, but in the inside, our organs might be fat in our organs, like our liver. It could be, it looks differently. So with the body composition, you can take a Dexa scan, correct?
Yeah, exactly. That's probably the top level way to get the assessments done. It's definitely my favorite. But we can help people to understand more of what's actually happening with their body. So there's the obvious answer of when you look at somebody or if you look at yourself in the mirror, you can have a pretty clear perspective as to how your body looks on the outside. I think that is a piece of the puzzle, but I think most people are actually really surprised to learn that what is grabbable, like any of the fatty tissue that's on the outside of your body that you can grab with your hands, has very little impact on your health. It has very little impact on your longevity. And changing that can help you aesthetically if that happens to be your goal. But from the purpose of like medical and health and trying to get you to live a long and happy life from that perspective, it actually has very little impact. So further, you can have somebody that doesn't have a lot of fat on the outside, but their body has decided to store all of the fat around their organs. So you were kind of briefly pointing to this earlier. It can wrap around your liver, which can very much pump inflammatory markers directly into your liver. It can wrap around your heart and notably increase cardiovascular disease. We've actually found that most of the things that were originally attributed to increased fat mass and the risk that comes with it had nothing to do with the fat on the outsides of our body. It was actually the fat on the inside. So I wanted to chat about some of the ways to get to know that, to set some goals for people today, some ways you can assess this yourself, and then the gold standard. So things like DEXA scans, where you can actually go in, you lay down for, I think it's about 6 minutes. I've had a few of these done now. You can get a really good perspective as to where these numbers really are, and it can help you to either set goals or to understand how important this is for your individual health.
So it's really about increasing awareness of your body composition because it's beneficial what you can do better at the gym, how do you eat healthier, and to live longer.
100%. Most of the recommendations people are given are based on large studies, which will funnel everybody into an average. So this is really useful information. I really don't want to downplay the value of research. Research absolutely moves us forward. It absolutely gives us a much better idea as to where to go. But what we're missing from that and the new version of medicine, the new way that we can understand the human body and the most efficient way to push people forward is understanding how your body works, not how the average body works, and understanding what your body responds to. So if we were to take a look and find that, let's say myself, if I go in and I have an assessment done, let's say I get a DEXA scan and I find that one, my visceral fat is high, and two, my lean tissues are lower, like just relative to the other numbers that we measure. I find that on average, I don't have as much muscle and I have more visceral fat. That completely changes my list of goals. Visceral fat will affect my longevity, it will affect my health, and it is something you can go directly after. Most people actually aren't aware that visceral fat has more blood vessels than average fat does. That's part of the difference in this tissue. We can target it to some extent, like we can actually lose it on average faster than we can lose other types of fat. So it's super interesting that this is the one that is most negatively associated with health, but we can very directly go after it. And then the lean masses, if we actually look at some of the recommendations for, say, how much protein to eat, how much resistance training to do, how to structure your workout plans, it's actually a lot easier to come up with a plan that is going to move the needle for you if we know where you're starting from. The lower somebody's lean mass, the higher their protein recommendations. If their lean mass is already really quite high, I mean, depending on their goals for it, we might still keep it high, we might bump it down. We have some options depending on what we're trying to accomplish, but we have clarity once we've identified the numbers. And these assessments give us that. Like we had a brief chat before. I went and got a few of these DEXA scans done. Like the very first one, we hooked up with a local provider of private DEXA scans that we really quite like. It gave us the opportunity to bring in the whole clinic and give everyone a trial to actually see what this looks like. What does this feel like? What's the experience of it? And how long does it take? So again, I think we're laying there for 6 minutes each. Like it's not a really long assessment. It's really quite easy to do. You can walk in off the street and basically sign up for it. You don't need to wait for a medical doctor. That's one thing I really wish to kind of scratch off of everybody's understanding is that this sort of gatekeeper phenomenon as to whether or not a doctor will give this to you is not going to be the wall that you hit that stops you from doing it. If you want to go in, it is private pay. It's not as much as most people think, but you can actually go in and get these assessments done yourself, often today or tomorrow. Like it's shockingly available if you know where to go. With mine, I was able to find that even though my numbers generally look good, I'm happy and lucky and I've worked hard to try to keep things in a good positive place. I did find that my body fat percentage was higher than where I want it to be, and my visceral fat, despite being within a normal range, is still higher than where I would like to see it. I don't like to compare to averages and normals. In my humble opinion, the average level of health isn't very healthy. I think we can really do better. Everyone has their own list of goals and priorities. If we're going to use that as the benchmark as to what people should hit, I would unfortunately say our average health is a lot lower than what I would want for myself, for my family, for my loved ones, and for my patients. So I try to help people to move forward. Once I got those numbers, I was able to make a change. It actually notably changed the way I was training at the gym. I wanted more muscle. I wanted to drop some of that fat, and I wanted to see how much of a difference I could make in the visceral fat. So it was super interesting. And actually, thinking about it, we also found that I had a bit of a muscular imbalance between both of my legs and both of my arms. And between the first and second DEXA scan, I lost 7 pounds of fat, which, to be completely honest, that was quite surprising to me. It was a much bigger number than I would have guessed or that I would have thought I sort of needed to lose. It's so interesting to actually see these numbers change. I was able to gain just about 3 pounds of muscle. I was able to drop my visceral fat. I think it was about 80 grams. I gotta look back. I mean, for men, off the top of my head, it's typically like we want you under about 500 grams is the sort of the average benchmark, and women I believe is under 400. I should have looked these up in advance and actually had them. I believe those numbers are right, but I was able to drop down I think another 80 from I was already under the limit. But it's super cool to actually see that difference. And for me, having those numbers in front of me really clarified what do I want to do? What do I want to accomplish? I wanted to personally turn my protein goals up. And it was super cool to do all of that, balance out my arms and my legs. They were both like much more symmetrical at the end of that time. And cranking up the protein and changing my training, I was able to gain just about 3 pounds of muscle within that. I
Mm.
think it was between 2 to 3 months. So everybody's experience can be quite different on this, but I was training before. I was very aware of my diet before. And actually getting numbers I found really unlocked that door to see what am I specifically trying to change. And the more clearly we understand our goal, the easier it is to make a plan to hit it.
Yes, and it gives you that confidence that you're taking control of your health.
Absolutely. Yeah, and I mean, from the flip side, because there's a lot of folks that go and get some assessments done and the numbers aren't where they want it to be for whatever reason. Either it's pushing more toward a true health and longevity problem, sometimes a crisis. We really need to get this under control if you want to live your best life as long as you can. Whereas others want to push it forward because they have athletic goals. So it is quite different depending on what we're trying to accomplish, but sometimes these will dig up people that think, actually, my body composition is in a great place, I have no concerns. And we find that they have a unique body that will prioritize building visceral fat. So they don't have a lot that you can grab. They actually look often quite fit, or their body shape is not the kind of shape that you would expect them to have a high visceral fat, but they very much do. And sometimes that is fatty liver. Sometimes that is wrapped around things like their heart and other organs that absolutely increases risk for a number of things that we don't want. Once we have those numbers, we can make better decisions for our bodies. Like, is it worth it to have that drink of alcohol or not? How much of a buffer zone do I likely have for some of these things? It doesn't mean we need to live perfectly. And I mean, I have a lot of folks, they do the assessments, and it doesn't really change a lot of how they act or how they move. but they have clarity. They know where
Mhm.
they are, and they can make an educated decision with that information.
It's for, bone rest as well, bone density, right? There are so many benefits for performing better in your training for the Vancouver Sun Run or for a marathon. But I'm curious to know, Dr. McMillan, how often should we go for a DEXA scan?
Ooh, good question. It'll completely depend on your goals. If I
Mhm.
had my way, everyone would get one done, like at get one, right off the hop, because those baselines are so very important. If you get sick, if something changes with your health, you get a significant injury that sidelines you either from your job or from whatever your workouts and athletics are, it's really nice to have those numbers. And jumping back briefly to something you also touched on, I've focused almost entirely on the body composition portion of DEXA. There is a really cool benefit of getting a sense of your bone density. Like this is the single best possible test you can do for assessing for osteoporosis or the less intense osteopenia. If you were to get your first test done, it is much easier to understand how often to do it after. I think there are some people that'll have a little bit more of like a, I guess, aggressive assessment to say every few months or every 6 months, just regardless of everything else. I would gauge that based on one, where you're starting from and how much change you need to do, and two, is this helping you to move the needle forward? So, for example, I'm getting my tests done closer together because I want to make change. And I really like seeing those numbers. That's very motivating for me. It's very clarifying as well because if I'm putting all this energy in, I do not want to spin my tires. I do not want to burn out some of the resources and some of just that mental resource that I have without clearly moving forward. So if I run a test, that tells me I'm doing the right things, I'm doing the right intensities, my body is handling it well, I don't have any clear signs of breakdown, fatigue, or especially in the case of DEXA, I'm not seeing just a plateau where I'm not gaining the way I expect, or maybe I'm gaining fat by accident because my calories aren't right, or it helps you to dial that side of it in. On average, I would imagine once a year would be good for most folks, but it really depends on how much change we're making, where we're starting from, and if we have risks of other things like if osteoporosis is happening, if we're making some changes to try to help with bone density, if somebody's considering medications on that side, like there really are a lot that can play with this. My most common is like 6 months or a year, unless we're in a change phase, and then we crank it up.
It's never too late to get a DEXA scan. I mean, really, it's like, you could be an older adult saying, "Oh, I don't need it. I'm older now." But I think it's really important. It's for everyone that wants to make these goals or these changes in their lives.
100%. And I also think it's really important to see that depending on what age you are and what
Mhm.
just phase of life you're in, the goals can be very, very different. So I see patients, I mean, all the time. There are some that really do have big levels of concerns with their bone density. I have had people come in, their primary goals were dealing with pain and discomforts that came from just straight up compression fractures where parts of their back, the bones were not strong enough to hold their weight. They didn't really do any heavy lifting or anything exciting. Just the gradual load over time slowly crushed some of the bones in their back, and they lost quite a bit of height. So if you've ever heard of people that after you get beyond a certain age, you're much more likely to lose height, that's not a good thing. A
Yes.
huge portion of that is actually bones compressing. And that doesn't feel good. That has the potential to like squeeze on nerves and lead to a lot of problems down your legs, down your arms, or down your back. These are really big deal things. I don't have the numbers or stats in front of me, but if our bone density is really low and we're much more likely to have fractures, beyond a certain age, I believe it's after about 60, some of the major fractures, especially hip, which is the one that most people focus on, your likelihood of getting out of a hip fracture and living, I think it's beyond 1 full year after you break a hip, is
Oh,
something like right around 50%. It's shockingly low, or at the very least needing long-term care afterward. So I don't like the idea of just focusing on bone density. I think we go wrong and tell people this is the only thing that matters. We need strength. We need balance. I mean, you can have the best bones in the world, be an 18-year-old with like prime bone density, and still have a lot of big breaks. If you're living a crazy life, not balanced and coordinated, you go for a roll down the stairs. There's always more to consider. I don't want to just paint this as a complete black and white. You get all the answers you ever need, but you can get clarity on big things. And I've had men that were 40 years old that really should have good bones by every other metric that we have. They're not at high risk for really anything on that side. But when they do their test, they find actually bone density is a big concern of ours now. So it changes the approach. It changes what we're doing so that we can really give them their best chance to live a long, healthy, happy life, to do whatever they want long term. And we can get those answers in ways that you just can't otherwise. Like, if people really don't want to go through some of these tests, you can do just a very simple assessment where you take a measuring tape, like ideally one of the ones that really bend and fold that are meant for measuring things like stomachs. You go around your waist. You can go once around your waist and then measure your height. If your waist is under half of your height, generally speaking, you're doing pretty good. I think we can do better than that, but if your waist is greater than your height, regardless of what everything else says, that's probably going to be a good priority because there's a really good chance you do have a buildup of visceral fat.
Mm.
We can be much more specific if we do, again, a gold standard like a DEXA scan. There are in-bodies, which is, I think right now, like the top of the scanners or the scales that you can stand on that will send electricity through your body. You don't feel it, it doesn't hurt, but it can get a fairly decent assessment of like body composition, muscle, fat, and that. It's not perfect. It's really not great for visceral fat, but it can give you a sense. There's the Withings and the Humes, like the home models of these things that you can buy as well. There's a lot of ways to do it. We have an ultrasound at the clinic, and there is actually some research that you can apply the ultrasound to different parts of the body. It's different for men and women, but you can pretty accurately measure, like within a millimeter, of how much fatty tissue you have at each of these parts of the body, and you can use that to calculate your total body composition. So there are some ways we can do it in clinic that are actually surprisingly accurate as well. Not DEXA level, but pretty close, and I believe they're actually above the in-bodies and some of the more expensive sort of commercial grade assessment devices. There's a lot of ways you can look at this. I really like, at the very least, like a DEXA as a baseline because we know where you're starting from. And every once in a while we see things that are really unexpected. So if we identify those early, it is so much easier to go after them. Whether we decide to make major changes or not, I mean, everybody's different. But in my mind, when you have that information available, you can prioritize as a educated adult with this information. Is this important enough to make changes? And most importantly, if I'm going to put energy forward, how can I be the least likely to spin my tires? How can I really get some effect? Because there's nothing more demotivating than putting in all this energy and not seeing the changes you want. So this is one of the ways you can dial that in.
And the takeaway is you know where you're going to be, you have that confidence, but also the measurement. Like you can now know and feel, okay, what changes do I need to make?
Exactly. And specifically, not what does the average person need? What does the research say will help the average person? Which again, if you really don't do any assessment, the research is absolutely the best way to go. And we still use the research to determine, once we know our goals, what's the most likely thing to get us there. So still some great information there. But again, we can do better. We have access to better. And it's almost available at your front door now. I'm a huge fan of that. Using what we can to get the most out of what you're already doing and to be sure that what you're doing is actually helping.
Dr. MacMillan, what would be the first step to come and see you?
Yeah, if someone wants to come see me, I mean, geez, there's a lot of ways to get in touch with us now. You can give the clinic a call. You can reach out to Delbrook Integrative via email. You can book yourself online. There's quite a few ways in. So certainly Dex is one of the things that we talk about. Lots of other assessments depending where people's goals are. I'm a huge fan of blood tests. The vast majority of them, we get the results the next morning. Like, it's very fast. We have a cool relationship with Life Labs. We actually do blood draws in-house. In some cases, we'll even do fancier treatments. We have access to a lot, like a simple nutrient IV. If people are wondering where their nutrient levels are, we don't have great Life Labs tests to determine a lot of nutrients. If I load somebody up with a reasonable, safe amount, but more than what you would get with your standard diet, and people feel amazing the next day or the day after, it tells me very likely these nutrients are a good thing, and then we can talk about dietary changes. We can talk about supplements. We can see if IVs fit into the program or if we want to exclude them and just use that as a diagnostic. Once people are in the door, there's a lot of ways we can make that change and a lot of ways we can cater a program to where somebody's at. Because some people are ready to go hard, make all the changes, and really push forward. Some people just aren't there, and they don't necessarily need to get there. My goal and my job is not to tell people what their goals should be. I can help to clarify those things if that's what they need. My primary job is I want people to be healthy enough they can do whatever they want to do and achieve their goals. So that's where I try to position myself. That's how I try to help my people.
Dr. MacMillan, it was a pleasure speaking with you today, and I'm looking forward to having you back on the show. And we were talking about body composition over body weight, and thank you again.
Yeah, it's awesome to be able to dive into this. I get a lot of questions, so it'll be fun saying, well, actually, we've done a podcast on this specific topic, so go check that out, and we can help to educate the world, one podcast at a time, get that out to our people and a bunch of others, and thank you for the opportunity. I've had fun with this. I always do, so I'm sure I'll be back again.
Thank you again.
Thanks.